chapter 28 real quick on collecting and testing specimen. Now, specimens basically are different samples that you might collect. They're going to test them to either prevent some sort of a disease or maybe to diagnose your patient, test it in a lab, or sometimes even to treat a disease. Now, you have to have a doctor's order in order to collect a specimen. They will tell you exactly what they want and how they want it collected, because sometimes there's different ways to collect the same type of specimen, and they will let you know what it is they are wanting. Now, whenever you get a lab sample, most of the time you have to fill out this big piece of paper. It's called a lab requisition, and basically, like, you'll put all the patient's information on there. You'll put what doctor ordered it, the doctor's information, some of their insurance, what kind of medical insurance they have, and like all this information on this lab slip. We just call them lab slips. We don't actually call them lab requisitions, but technically that is what they're called. So that's what you're going to need in order to get a specimen. Now, one of the most common specimen that you might be involved with is a urine sample. Getting a urine specimen. Urinary tract infections are rampant, especially in the geriatric population, just because they are more susceptible to it. Okay? So, basically, they're going to do a urine test on the sample they get, and the first way you can collect it, they just call it a random urine sample. Bless you. And again, this would be something that you might collect for a routine urinalysis. And whenever you are charting, you're going to, instead of saying urinalysis, you're just going to put U/A. So if someone says something about a UA, they're talking about a urinalysis. Okay? So this, with a random urine specimen, there's really nothing special you have to do but just get them to pee in a cup. A lot of times they can even do it themselves because there is no special preparation for it. The only time you would help them is if you have a patient that is too weak or too sick to do it. Now, the next kind of urine sample would be called a clean catch specimen, and a lot of times it might be called a midstream specimen, clean voided, clean catch. Okay, those are all things that you might hear to where you know that they're talking about the same thing. Now, and basically what we're going to do this time is we're going to use a sterile specimen cup. Okay? And most of the time, the way you're going to know whether it's sterile or not, the ones that are not sterile usually just come in a box. You have a big box of them. There is no package around it. Okay? If it is sterile, most of the time it will come in a plastic package that you have to open it up to get the specimen cup out. Sometimes they'll even have a sticker over it to show that it's still intact. And as soon as you start twisting the top off, it breaks that seal to let you know, okay, to let you know whenever you get it whether it's been opened or not or tampered with, so you'll know it's still sterile. Now, what you do with a clean catch is before the patient uses the bathroom, they have some special wipes that you will use to clean the perineal area. And again, if your patient can do it, sometimes I'll let them do it too. But you have to clean the perineal area really, really good to try to kill any germs outside the body, because we don't want that to kind of mess up our sample we're trying to get, because we want to know what germs are in the bladder, not on the outside of your body. Okay, so you have to clean the peri area first. Sterile gloves are needed, and you need a sterile specimen cup. Now, basically, once you have cleaned the peri area first, you let your patient start to urinate, and then you stop them after they get that first stream out. Then you start collecting the urine in the cup. Now, why do you think they would do that? Why would they make you start peeing first before they start collecting it?
It's almost like the spray can of cheese tube or whatever, how it's like icky on the outside, and then you got to get the dry stuff first, and then you get the good stuff.
Right. See, by letting them void first, you're kind of flushing out any germs that might be in the front area of the ureters and urethra. Okay? That kind of cleans out some of the gunk, some of the germs that might be out there before you get to the true sterile urine, right? Good. So go ahead and get it in that sterile container. Let them pee in it, and sometimes you may actually have to hold the cup for them if they're too weak or sick to do this, or maybe they have some confusion and things like that. I mean, you might have to like let them start peeing and then throw it under there, okay? If they can't stop the flow. So that's something that you might get. Now, a different type of urine collection is called a 24-hour collection, and it is just what it says. You're collecting all the urine that they pee in a 24-hour time span. Now, all the urine that you get has to be chilled on ice or in the refrigerator, because otherwise it'll start ruining and getting nasty, and they can't truly test it. And a funny story about that is I had collected, because they give you like this special jug to put it in. Well, when I worked over at Mills, I was trying to find a cooler of ice to put it in, and the only thing that I could find was some of those old big round ones that like people used to carry ice water in, like a big igloo that has a spout on it, and like people normally use it just to put ice water in, and you would drink straight from that big jug, or you pour it out into a cup. Well, when I put ice in that thing, and I stuck the 24-hour jug inside of that, screwed the lid on, and I took it over to the lab. And when I got over to the lab, that girl looked at me like, I can't accept that. I'm like, what? She's like, well, that's supposed to be in a jug. I'm like, oh, it is. She goes, no, I mean, like, you have to have a sterile container and all this other stuff. And like, she thought I just like let them pee in this igloo container when they were supposed to pour it out and test it. Like, she didn't realize I had it in ice inside of that thing. So like, she thought I was like crazy or something, letting somebody pee in an igloo jug. It's kind of funny. It's kind of weird, but so it does have to be either refrigerated or on ice. Sometimes they put a preservative in there if they're doing certain types of tests to keep the urine from kind of ruining, or from, if it's just sitting there and it's in a good warm environment, it's going to grow extra germs that we don't want it to do. Okay. Now, and when you actually start the 24-hour period after they pee. Okay, you let them pee, then the clock starts. Okay, because that cleans out their system and gets them started. Okay, so you don't put that first pee in the jug. Okay, we're only going to start the clock after they get finished. Okay, we want a clean, empty bladder. The timer starts. Then every time they void from then on, you're going to collect it in probably what we call like a hat or something, and pour it into that jug every time. Okay. So you throw away the first void, but then you save the next for 24 hours, and then as soon as that time frame is up, ice it and send it to the lab. Now, sometimes different kind of tests they might do on your urine is they may want to see what the pH is. Okay, so what does pH measure? You learned in chemistry.
The acidity.
Acidity or
basic.
How basic or alkaline, the same meaning, is. Okay, so they may want to test the urine. Okay, the normal pH of your urine should be between 4.6 and 8, which makes it what? Acid or base?
Kind of both. Oh wait. Mainly acid.
It leans toward the acidic side.
Yeah.
Which is why we don't want to stay on patients' skins, because it can an acid on skin is never good, right? Now, another thing they might do, especially if you have diabetic patients, is they may be testing your blood for glucose, which is sugar, right? Or ketones, okay? When people are diabetic, if they're having if their sugars are running too high, they tend to have a lot of ketones in their urine. So that is something you might test the urine for. A lot of times you're going to do it 30 minutes before a meal and at bedtime. And the doctor uses that information to help adjust any kind of medications or diet that you are using to treat diabetes, okay? Now, testing for blood. There are times, especially if you have a really bad infection, you might actually see blood in the urine. And sometimes it's enough that it's noticeable, and sometimes it's not. I mean, the urine may look a little more amber colored because there's just a trace of blood in it. But, you know, you may not be able to see it except for through testing. So they do test for that. Now, reagent strips. If you use strips to dip down into the urine to test them, because you can do ketones that way and certain things, the pH, things like that, the end of the strip that is actually used for testing, you want to make sure you do not touch so there's nothing on your finger that could cause a different reaction on the strip. So you're going to kind of dip that down into the urine, and obviously you're wearing gloves, right? And then on the bottle, there will be different colors on the bottle, and it'll tell you what that means. Now you can actually do a full urinalysis with these testing strips, because some of them will have, like, they look like little big pads on the strip, and you might have 10 little pads on there. So you dip it all the way down in there, pull it up, and you wait a few minutes for it to turn whatever color it's going to turn. And on the side of the bottle, you kind of compare and look, and it'll tell you, okay, well, the glucose is blah, 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 if it's this color and this color and this color. So you can actually do the testing yourself, which is, I always used to think that was kind of fun. Again, follow the manufacturer's instructions, okay, and that's for everything, right? Now, straining urine, getting kidney stones, or calculus is what is technically called. A stone is called calculus. So that is very common. They do make special little cups that have a kind of a mesh-like strainer and kind of a little mesh at the bottom of the cup. And if someone is trying to pass a kidney stone, then a lot of times the doctors will want you to make them, every time they pee, to go through this mesh, because that should catch any kind of kidney stones. And those are always kind of neat to look at, just because I'm weird like that, I guess. But my husband has a lot of kidney stones, so like we do that a lot, and he's caught quite a few kidney stones. But they like to test the kidney stones sometimes to see what they're made of, because they can figure out how to make changes in your diet to try to keep you from continuing to produce these. Because some of them are caused by calcium. And I've heard, you know, more recently that a lot of times, like, drinking a lot of pop is responsible for a lot of the different kidney stones and things like that. So they can be different sizes, and a lot of times they're very jagged, and they're not just like a round stone. A lot of them are very, very jagged and have these jagged edges, and that's why it hurts so stinking bad. Have you guys ever had one? Anybody ever had a kidney stone? Okay, well, my husband does, and like, I've seen him in so much pain he was climbing walls and like nearly screaming, like it hurts that bad. And so that's the guy's equivalent to having babies, they say, getting a good kidney stone. And again, because it's poking through there, it's got these jagged edges, it's cutting stuff, and not good. So that's kind of what they look like. They are very, very, very painful, and if they cannot be passed, or if they're too big, so I've heard of some that are so big that there's no way that they could ever get them out, then they actually have to do surgery and go in and remove them. If they start blocking like the ureters and the tubes that won't let urine around it, then they have to go in and do emergency surgery to remove it. Now, stool specimens. There's a lot of things we look for in the stool. One of the main things that we do is called like an occult blood test. Is we're looking for blood in the stools, because we can tell if someone has some type of internal bleeding, like in their bowel system, depending on these tests. Okay, so we're looking for blood, maybe fat, maybe you're looking for microbes. You know, I've had a student with C. diff, which was the same thing. Y'all had a patient over meals, wasn't it, that y'all had to suit up for, that had C. diff, because it's so contagious. Well, the only way you know if they have C. diff or not is to test their stool. Did you guys collect a stool specimen that day? No. Okay. You missed out on that one. You did? I was thinking somebody did. So it's, you know, that's how you test it. You have to have the poop to see if it's got a germ in it, right? Worms. I don't see and hear a lot about worms as bad as there used to be, or that you would see in other countries, because we worry more about worms from either poor water systems, like drinking water from a stagnant water creek, or undercooked pork and different things like that could give you worms. We don't see that as much in the United States unless people travel to other countries, because we have a very strict, the USDA is very strict about the regulations of our food and stuff here, because we live in the best country in the world. And the one thing that you want to make sure when you get a stool specimen, make sure that you collect it separately. Sometimes we'll take the hat and turn it and put it towards the back of the toilet, so that, because you don't want urine getting in there too. So you have to be kind of careful about that. Now, when they suspect that there's a possibility of an internal bleed, they will have you test that stool for blood. And most of the time, you can actually see the blood if it's in the lower intestine. So what color would you expect it to be if it was in the lower parts of the...
Black.
If it's in the lower parts, it's going to be red blood.
Oh.
Okay? If it's in the higher parts, it's going to be black. And why would you think it would be black?
Well, because it's mixed in with the brown and the darkness.
Okay, I can take that. So it's mixed in with the other stuff for longer, so maybe it changes the color. But also, what's going on in your digestive system is your body's digesting stuff. That means it starts digesting that blood as well. And when that blood starts breaking down, it changes colors. Okay, it turns black. So black and tarry stools is called melena. And that's something that if you see is we especially sometimes we say it looks like coffee grounds or something. And that lets us know that it may even be as high as the stomach at that part, because it's had so much time to digest, that blood has. It turns it very black and tarry, sticky looking, okay? If it's occult blood, sometimes you may notice zero difference in the stool. So that's why we have to do these occult blood stool tests, okay? And again, a lot of times you can do colon cancer screenings as well, so that's a good thing, especially for guys. Guys are more, get colon cancer more often than women do. And because sometimes you don't have the symptoms a whole lot, guys with colon cancer and getting checked for that is very important. Now, sputum. These are probably some of the worst ones to get, because again, your patient has to hock a loogie and give it to you. That's fun, right? But again, we're looking for blood, germs, any kind of abnormal cells, maybe cancerous cells, things like that. So again, they have to just cough up and give that specimen to you. Now, that's going to be easiest in the morning time, because you've laid down all night long and that sputum just collects. Because the more you exercise and do stuff and breathe, the more that kind of naturally comes out. But at nighttime, you're not up, you're resting. So try to get it in the morning. And as far as if they can't cough very well, we try to do something that's called postural drainage, which is by changing their positions. But that would be something a nurse or a respiratory therapist would do. Okay. Blood glucose. If you have diabetes, we want to test your blood sugar. Now, most of the time you're going to use the capillary blood in the fingers, and the little lancet you use will have a cover over it. You'll twist off the top, because it should be sterile, and you never reuse those before you, most times, stick it like a little pin and you just pop, and it pops it and you get the blood sample. Now, the blood sample goes into the strip that's already in your little glucose monitor. You just kind of touch it down, it sucks it up, and takes it 5 seconds, and you got a result. Super easy. Now, you do have to make sure whenever you're doing this, most of these people do it at a minimum once a day, and more likely at least 2, 3, 4 times a day. So their fingers get beat up. So you do need to really inspect the skin, make sure you try to use a place that hasn't been used. If you're doing it multiple times in a day, use a different finger, a different hand. You know, try to really kind of break that up so you don't really badger one finger more than the other. So always stay away from anything that's bruised or swollen. You know, you don't want to use non-intact skin. And again, we try to go towards the tip of the finger. You can get better blood there. Now they say the middle or ring finger. I've always tried to use the ring finger if possible, because have you guys ever had your finger poked before? Okay, don't you stay sore for a while after that? I mean, I think every time you touch it, it's kind of sore a little bit. So a ring finger is just a finger we don't use that much. You don't put as much pressure on it, you don't use it as much. So to me, by using the ring finger, it won't be as sore for the patient. They won't notice it as much, okay? Now make sure you use make sure you clean it really good with alcohol, and you do have to let that alcohol dry real good before you poke them. Any ideas why? I don't expect y'all to know this stuff, I just wondered.
Germs are evaporated off of it.
Maybe. But if it's not fully evaporated, that means the alcohol is going to mix in with that blood, and it can possibly change your results. Okay? So we want to make sure that alcohol is fully dry before we poke their finger. And just make sure no matter what glucose monitor you use to follow the instructions, most of them are pretty much the same. So that's pretty good. Now, again, quality of life. Explain the procedure to the patient. Always make sure that they know what's going on so they feel more comfortable with what they're doing. They need to know why they're doing it, who ordered it, things like that. And again, if they can collect their own specimen, let them. Give them some independence, okay? Make them feel like they're in control of something, okay? Any questions? Okay.